The non-surgical 15 minutes nose job is a new and exciting alternative available to people interested in enhancing or improving the shape and contour of their noses without the pain, the price, and the recovery time associated with invasive surgical nose job. Going under the needle is certainly less complicated than going under the knife for a nose job, but modifying the nose's shape is never risk-free. In this video, I will tell you all about it, the procedure, the cost, possible side effects, what you can or cannot do after the treatment, and how it compares with surgical rhinoplasty. You may have heard of non-surgical rhinoplasty, referred to by its nicknames liquid nose job or 15-minute nose job. A non-surgical rhinoplasty is actually a dermal filler procedure that changes the shape of your nose for up to 18 months. You may wish to have a 15-minute nose job for bridge augmentation, nasal defect or hump correction, to straighten your profile, nasal tip projection, enhance nose balance and correct asymmetry, smoothing minor indentations, and last but not least, create a more tapered and slender looking nose. Nose fillers are also ideal if you have had an accident which has caused a deformity, or you've had a nasal surgery and are not quite happy with the results. Nose fillers can then be used to fine-tune the results of your surgery. You ask, how does it work? Non-surgical rhinoplasty uses dermal filler substance to change the shape of your nose. By far, the most common substance we use for this treatment is hyaluronic acid gel. Once injected, the filler settles into where it has been injected in your deeper skin layers and holds its shape. This can change the appearance of your nose for anywhere from 6 months to 3 years, depending on your skin, your desired results, and the type of filler used. The procedure is fairly straightforward, especially compared to surgical rhinoplasty. After the consultation, where you discuss your desired results, your doctor will have you lie down with your face tilted up. You may have a topical numbing cream applied to your nose and the surrounding area, so you will not feel pain from the needle. After the topical anesthetic takes effect, your doctor will inject the filler into the area around your nose and maybe the bridge of your nose itself. You might feel a slight pinching or pressure while this is done. The whole process is normally fairly straightforward and take anywhere between 15 to 30 minutes. What are the possible risks and side effects? For most people, the only side effect of liquid rhinoplasty they will experience is a mild redness and tenderness in the area of the injection in the day or 2 after the procedure. There is a risk of bruising at the injection site, although this is uncommon and resolves within a few days and can be covered with makeup. Although I've never encountered this side effect in my practice, if the filler is injected by a practitioner who lacks the relevant skills and experience, it can migrate to other areas of the nose or the area under your eyes. The nose is a delicate area with complex networks of blood vessels. It is very important that the attending clinician is acutely familiar with the anatomy in this area. While uncommon, possible serious complications include permanent tissue death and vision loss. This is a significant consideration in a patient who has had surgical rhinoplasty, as the altered anatomy and the inevitable scarring in the underlying tissue can complicate outcomes and indeed increase risks. So how do we minimize the risk of accidental injection of filler into the blood vessel? The majority of filler injectors use a sharp needle to inject their filler. I don't. Instead, I use a blunt instrument called cannula. Sharp needle can pierce veins and arteries beneath the skin, and in addition, when using a needle, multiple injection points are required, which can increase the risk of hitting a blood vessel, never mind the trauma to the skin and subsequent bruising. While a blunted cannula is not 100% safe, by virtue of the fact that it is blunt, it pushes aside any arteries and veins it encounters beneath the skin, drastically reducing the risk of accidental injection of filler into blood vessels. What should you expect after the treatment? After the non-surgical nose reshaping procedure, you may notice a mild redness, swelling, and tenderness at the injection sites. Within an hour or two, this should start to resolve and you will be able to better see your desired results. You may use an ice pack over the injection sites, but try not to put too much pressure on the nose. Results should be fully visible within 1 to 2 weeks. Any redness or bruising should completely subside by then. As far as downtime, people who swear by liquid rhinoplasty love that there is practically no recovery time. You can be back to work and your normal activities this very same day. What can you do to prepare yourself for the treatment? Your attending doctor should give you detailed instructions on what to do before the procedure. In general, we advise our patients to avoid blood thinning medications such as aspirin or anti-inflammatories such as ibuprofen. Make sure you let your cosmetic doctor know if you are on any blood thinning medication. Drink plenty of water and have something to eat before your appointment. Now comes the question about how non-surgical rhinoplasty compares to traditional surgical nose job. Non-surgical rhinoplasty is for you only if you're looking to experiment with how modifications to your nose might look, or if you're looking to tweak your nose in small ways to change your appearance. In general, the advantages of non-surgical nose reshaping with fillers include: it allows you to avoid going under general anesthetics. You will have a quick recovery. You can return to work and your regular activities in the same day. Results are not permanent, so if you're not happy with the result, it is just a matter of time before the fillers metabolize. It is reversible if hyaluronic acid filler is used, and the cost is much lower than a surgical rhinoplasty. The disadvantages of non-surgical rhinoplasty are: if you're looking for a dramatic change to your appearance, this procedure might be disappointing for you. If you're looking for a permanent result, there are side effects such as bruising and swelling. There is the possibility that a misplaced needle could result in permanent damage to your skin tissue or your vision. You may need more than one session to achieve your desired result. The advantages of surgical rhinoplasty are: the results are bold and permanent. This procedure has been carried out for decades, so side effects and possible complications are well studied and well known. The above said, surgical rhinoplasty comes with some disadvantages too, and they are: if you do not like the result, there is not much else you can do besides wait for it to heal and then get a revision rhinoplasty. This procedure is usually conducted in a hospital under general anesthetics. risks of complications like infection are much higher, and it costs significantly more than non-surgical rhinoplasty. Finally, how much does it cost? Costs vary depending on what kind of filler your doctor chooses, the skills and experience of your doctor, and how many treatment sessions you need. You should receive a detailed cost breakdown from your clinician after your consultation, so you know what to expect. Generally, you can expect to pay around £400 to £600. There you have it, everything you need to know about non-surgical rhinoplasty. Please visit my website for further information and before and after pictures.